Live, and we are on YouTube. I tried to do Facebook, couldn't do it, so now we're going to do YouTube, which is fine. New information came down today. I know it's late in the day, it's 4:54, and I wasn't going to do a show today, but I felt it was really important to get this in out. University of Surrey. When we talk about the coronavirus, which you notice has disappeared from TV, with all this craziness about protest, Black Lives Matter, all the above. Coronavirus got pushed away, and I think that was a bad thing, a really bad thing. And I think we're going to find over the next couple of weeks whether or not all of this social distancing thing was really important. When all these people have mobbed together everywhere, are we going to see a surge in coronavirus infections? An international team of researchers led by Professor Margaret Raymond at the University of Surrey has identified a link between COVID-19 cure rate and regional selenium status. Now, this is going to the origination site, which was China. Publishing their findings in the American Journal of Clinical Nutrition, researchers using data investigated possible links between selenium levels in the body and cure or death rates from those with COVID-19. And again, this is going back to information early on in China. Selenium is an essential trace element obtained from the diet, fish, meat, and cereals, which has been found to affect the severity of a number of viral diseases in animals and humans. For example, selenium status in those with HIV has been shown to be an important factor in the progression of the virus to AIDS and death from that condition. China is known to have populations that have both the lowest and highest selenium status in the world due to geographical differences in the soil in which it affects how much of the trace element gets into our food chain. Margaret Raymond, professor of nutritional medicine at the University of Surrey, said this, quote, "Given the history of viral infections associated with selenium deficiencies, we wondered whether the appearance of COVID-19 in China would possibly be linked to the belt of selenium deficiencies that run from northeast to southwest in that country." And again, this has been a point of investigations forever, that certain areas going way back during the ice ages has stripped selenium from the soil. And there are areas such as Michigan that has been renowned as a thyroid belt because of selenium deficiencies in the soil. Examining data from the provinces and municipalities of more than 200 cases and cities with more than 40 cases, researchers found that areas with high levels of selenium were more likely to recover from the virus. For example, in the city of Enshi in the Hubei province, which had the highest selenium intake in China, the cure rate, or the percentage of COVID-19 patients declared cure, was 3 times higher than the average in any other cities in Hubei province. By contrast, Heilongjiang province, where selenium intake is among the lowest in the world, the death rate from COVID-19 was 5 times higher than the national average. Most convincingly, the researchers found that COVID-19 cure rate was significantly associated with selenium status, as measured by the amount of selenium in hair in 17 cities outside of Hubei. Now again, you can do selenium levels a lot of different ways. One of the oldest, and actually one of the most accurate, has been hair analysis. Most convincingly, researchers found that the COVID-19 cure rate was significantly associated with selenium status. Kate Bennett, a medical statistician at the University of Surrey, said, quote, "There is a significant link between selenium status and COVID-19 cure rate. However, it's important not to overstate this finding. We have not been able to work with individual level data and have not been able to take account the other possible factors such as age and underlying disease." Okay, fine. Rami Said, a doctor at Royal Sussex County Hospital in Brighton, currently taking a doctoral degree in nutritional medicine at the University of Nutritional Sciences at Surrey, commented, quote, "The correlation we have identified is compelling, particularly given the previous research on selenium and infectious disease. As such, a careful and thorough assessment of the role of selenium and how it may play in COVID-19 is certainly justified and may help to guide ongoing public health decisions. There's no doubt. And again, when you come down to selenium, you got to be very careful. The most accurate form, the most biologically active form is yeast-derived selenium, or selenomethionine. So if you're going to be a healthcare worker, be somebody who's going to be exposed, there's so many different things you can do, from the buffered vitamin C to an immune booster to vitamin D. And now we're adding to that list the right forms of selenium to get your selenium status up. I had to get this one out today because it's new. Put that into your pipe and smoke it. And again, if you want help with any of those kind of issues, give us a call here. Set up your personal time, 678-228-8900, 678-228-8900. Tomorrow, we're going to go back to my pharmacy side. We're going to talk about side effects of drugs. Okay, so make sure you tune into that tomorrow. We'll try to do that right at noon tomorrow. You can find all of our YouTubes, all the storage, right there from the front page of our website where it says Talk to the Doc. Click on there. It'll bring us right into your YouTube page, and you can listen to any of these shows and share them with others. The website is thenutritionshop.net, THE, thenutritionshop.net. And I look forward to seeing you soon. 678-228-8900 is the number to reach us here in the office. God bless you. Have a good day, and I'll see you back here tomorrow. Take care.